I'm Dr. Anthony Lombardi, and this morning we're going to talk about the effects of subtalar joint pronation, and I'm going to show you on the skeleton. Okay, so you see down here subtalar joint pronation, and it causes a valgus orientation on the knee. You see that valgus orientation on the knee? And it creates internal rotation of the tibia. So that predisposes people to degenerative arthritis on the medial side of the knee. Research also shows it predisposes patients to greater injury to the ACL. And the reason for that is because it provides a greater Q angle. If you read any of my webinars, click in the links in the description. There is the link to my webinar about foot assessment and treatment using with and without orthotics. What happens at the hip is a few things. So the pelvis tilts to the side of the subtalar joint pronation, and the pelvis as well tips forward. Now, because it tips forward, you're going to get an eccentric strain of the iliopsoas. And if we get an eccentric strain of the iliopsoas, and we have an internal rotation of the hip, we are going to get eccentric positioning of the external rotator. So the piriformis, the gemelli, and that is putting more pressure right over the greater sciatic notch on the sciatic nerve. And if the pelvis is tipped forward, the hamstrings that attach to the ischial tuberosity are eccentrically contracted. So you're getting weakness there. And if we're having inhibition, eccentric elongation of the psoas, it's reciprocal inhibition, the gluteus maximus, that would be inhibited. So what we're having here is this cornucopia of maladaptation. In the lumbar spine, L5 is rotated towards the side of subtalar pronation. So even if you correct the low back pain in your patient, or the hip pain, or the knee pain, but you don't correct subtalar joint pronation, this is continually going to become a problem in your patients. This is an example of a few modifications that's necessary on the orthotic. So one is a deep heel seat. That deep heel seat will stabilize the subtalar joint into neutral. You see on the left side, it's elevated. There is approximately a 4-degree rear foot varus post, and that is to maintain subtalar neutral. This is also an intrinsic post. You see it's not posted. This is better fitting inside the shoe. So click the link in the description. Also subscribe if you like these videos, and watch all of the videos in this playlist. But if you want to become better at assessing and modifying your